Hello, I am Valentijn Vis. I'm working as Associate Professor in the Industrial Design Engineering faculty. And since about 10 years I'm working in healthcare and design for healthcare. And in this small lecture I will talk a little about e-health and persuasive game design. In the healthcare system, as you will know, a lot of people are active and at work. Doctors perform surgeries, patients swallow pills, patients do all kinds of therapies, births are given, wounds are healed, and therapies are taken. In all of these activities, all of these people need a kind of motivation in order to do the right thing at the right moment. And in motivation, designers can help, because we as designers are partly or very good at designing motivations for people. We know how to design a product so that people can buy it. We know how to design a product so that people can use it. And perhaps also design something that people can keep using it. So in design for motivation, we have first to know what are exactly motivators and what are strong motivators. And we can find them in games, because as I think most of you will know, games are very strong motivators. When you play a game, you are kind of immersed or swallowed up in a kind of game world experience. So you have very strong motivators to do a specific action for a given task. So all these of the motivators of games, like leaderboards or challenges, rewards that you are given, metaphors that you are playing with, role-playing or fantasy worlds, they work very, very good, very effective. But how can you treat them as a designer? And also how can you treat them in a healthcare context? First, it was for us important to understand what exactly happens when people play games, and play games in a kind of context that people can learn something about it. And for this we designed we made a theory about 5 years ago on persuasive game design, which entails the process how people, when they play a game, leave a little bit the world of daily life and move towards a kind of game world experience. So game worlds and real worlds, they are, well, not the things around us, but they are the things that we experience. We can experience the same surrounding as a fantasy world or as a real world. Of course, not totally, but in effect, we can play with things. And what is the specific things about what's specific about games is that people are transported, leave a little bit the real world behind to get into a more immersive and engaging game world. This game world is often very fun and people like it to be there. They are motivated, they are free, because everything you do when playing a game doesn't have so much serious consequences. Whereas in the real world you always have to take care what you will do. It might have an effect on your life or on your relationships. So game worlds, they offer freedom and enjoyability and the kind of immersive or engaging power. Now that is exactly the kind of motivation that you can use as a designer. So if you put people into game worlds a little bit, people will be more motivated to perform specific tasks, and they can learn something about it, or they can change their behavior about it, when you use game elements in the right way. So that's the next question. First we understood what are game world experiences, and next is how to design for that. And for that it was this year that we wrote a paper about a method how to design for persuasive games. That's this paper. It's rather thick, but we wrote it together with a design company and also with a design method specialist, and we summarized it in this very colorful and playful recipe. It's a recipe for designing persuasive games. And this recipe has specific dishes, and if you follow all the dishes you have a fairly good chance that you end up with an effective game. The first dish is that you obtain the transfer effect. What is it exactly that you want to achieve with your game? Is it that you want people to learn something, to change their behavior, to stay more compliant to their therapy, to swallow their medicine more regularly? Well, that's the transfer effect, and that's often forgotten, and you have to talk with all your stakeholders about specifying what is the transfer effect for your user. What are you designed for? What is your design goal? The second stage is the user context. You want to investigate what your user consists of. What is his personality? What are the game elements that your users want to use or are motivated by? What is the kind of context of use? When can you insert your product into the daily life of the user? And also, what are the other users around your primal user? So, for instance, in healthcare, you would never have a patient on its own. You also almost always have a medical specialist or a general practitioner, perhaps some family members or informal caregivers, that are all part of the user context. And you have to know the whole context before you start designing. So you have the goal, you have the context, and then you can start your game design. And that's the design, the gamification. Therefore, we wrote all kinds of tips and some ingredients and utensils. You can all find them here and in the paper. And in the last stage, you can evaluate if the game that you designed really worked or not. Yeah, so we have a theory of persuasive game design and we have a method. And with this, we designed in the past years about 30 games. Some of the games were for elderly with dementia to motivate them for more active behavior, and that was the case of the Tovertafel. The PhD student Hester Andriessen made a huge company out of it. It was projection on a coffee table in care homes for people with dementia. Some games were projected, like swimming dolphins, and if you moved your hands, the dolphins would come to your hand. And it was exactly this kind of movement, the physical activity of these elderly people, that was our aim for transfer effect, so that worked. We also made a lot of games on therapy adherence, for instance, youngsters in addiction therapy, or elderly or adults with anxiety problems. We made games to prepare children for hospital visits. So on all kinds of transfer effect, we developed some games. And I will end my talk with a small case study of a PhD student from here, Marie-Roos van Doorn, on her persuasive game design, how she used it in addiction care. This product, it is called a Ready Set Goal product, and it's an app. It's of course a gameful app, and when the project started, a substance use addiction therapy institute came to us to help to ask if we could design something that would motivate youngsters with addiction problems, so who were on drugs mostly, to stick more to their therapy. So therapy adherence for youngsters in addiction care, that was the context. Then we first discussed the transfer effect. What is exactly what you want to achieve? Do you really want all these youngsters to never touch drugs in the rest of their lives? Then we can't help you, or at least we don't know if we can help you. But we can help you if we zoom in on a specific goal together. So we talked with all the stakeholders and all the therapy makers and the therapists themselves, and also the youngsters, in which part of the therapy we could design something that might be achievable for us as a designer and would help these youngsters. And that was inside cognitive behavioral therapy. That's the main form of therapy that all people use in mental health care. In cognitive behavioral therapy, people have to set goals. For instance, the goal can be to use less marijuana in the coming weeks, coming 3 weeks, for instance. And these people had, well, firstly difficulty to set the goals, but also to achieve the goals. And we thought, well, if we make a game that help people in setting and achieving the goals and providing some feedback, how they are and what they have accomplished, we might perhaps increase the therapy adherence. So that was the transfer effect we decided upon together with the whole context, and we moved towards the user research phase. We did some studies and interviews with all the clients, that is all the patients, and it turned out that most of them could be categorized as sensation seekers, very impulsively driven. So that was also, of course, correlated with their substance use. They want something and they want it now, and so long-term plans are difficult. So we have to perhaps use some game elements that has some risk in them. Then we investigated what is exactly the context, and the context was that a lot of these youngsters came to the therapy facility, but after the therapy they went home and for a few days and then came back to the therapist, so they were in ambulant care. So it might be some difficulty. They might be totally healthy and have nice promises in the therapy facility, but when they are on their own in their normal environment, they might still forget about all the things that they promised, or all the things that they wanted to do, and listen to their impulsivity or their sensation-seeking behavior, and use drugs again. So this ambulant care context was a little bit difficult, and we then performed a small user experiment in which we tested what kind of game elements would be favored by the different stakeholders. So we asked a group of patients, what kind of game elements would you like to appear in the game? And these patients, they said, well, we will like something that has some risk in them. So it's something that we can bet upon, that it's not certain that we get it, that there's some danger in it, because we like a little bit of danger and uncertainty, and then we can get some high profit. So that was the kind of wager game element, and we would include it later. And they also said, well, we like something that contributes to our personal values, to something that makes us feel better as a person, that we have something, that we can get something out of it as a specific person. And we asked the staff members, so the therapist as well, and they said, well, these youngsters, they will definitely like risks and wagers, but they are also very motivated by extrinsic rewards, so by money, for instance, or I don't know, freedom that they would get, or freedom from the therapy, that is, so extrinsic rewards. So there was a little bit of difference between what were the preferred game elements. The client said, well, we like personal values, and the staff members said they will like extrinsic rewards. So ask all your stakeholders what they like, and not only one of them, but best to have a lot of different groups. But they both thought that wagers would work well. So we designed a first game, minimal viable game, in which we used a wager and a metaphor that was a kind of mountain that you could climb towards your goal. We provided some progression feedback and rewards. And we tested it first with students, if it would work, so if all the buttons works on the app. It was a programmed app on the cell phone. And then we also studied it with patients. And the results were, especially with the patients, that they demanded more personalization. They want to have more control about the tasks they would set. And they also wanted to have more control about the rewards. So the rewards would be personal. They want to set their own rewards. Some of the patients want to be rewarded by a nice cake, and other ones by a visit to a concert or a visit to a party. And they also said to us that it was very important that the game would be integrated into the therapy as a kind of therapy module. So it shouldn't be something aside from the present context, but it would be, the deeper it would be integrated in the therapy, the better it would be. Because then they thought that the game was not just a game for leisure or for fun, but was something serious that would help them to stay away from the drugs. So, taking all these results from the small study and also the earlier context user research, we made a final design in which we used customizable rewards, customizable tasks, and a kind of metaphor still of a mountain that you could climb towards the end of your therapy. And we are testing it now on the motivation, so do people like it better than, for instance, standard therapy, and also on the treatment effect. So not only do people like it better, but also does it help them to stay away from drugs more than the traditional therapy. So it's just a little bit, it is a kind of packaging, this motivational design. So you use the core of psychological research on what kind of therapy will work, and you redesign it, you make it more motivational, and then well, what happens, I think it's about 20% more adherence to the theory. People will like it more, and because they will like it more, they will be more adherent to use it, and we hope therefore also that therapeutic effects will be stronger. But at least most people like it more, like to interact more with design therapy than with well, the more plain undesigned therapy. So in that way, we already as designers have some outcome. The learnings of these kind of projects is first, and common mistakes that people make, is that you have to manage your stakeholders. You have a lot of stakeholders. You have the therapist, you have the, like I said in the beginning, you have the patients, you have all the persons around the patients, like the friends or the family or the schools in this case. And then you have the psychologist who know what kind of therapy will work and what kind of for what kind of person. And you have often also design companies or programming companies. And all of these stakeholders have different expectations of you as a designer. They expect all something different of you. Some of you expect just effects, so for instance less drug use. Others expect really nice looking prototypes or products even that they can buy in the shop, and others expect very good theories. So you have to manage all the expectations, and that's something you have to be conscious of as a designer in this kind of overwhelming context of healthcare. And for instance, you can see this effect of this expectation in how you frame your product. If we framed our game for addiction care as a game that you could use during your therapy process, people were not so motivated to use it because they thought, well, it is only, I can use it if I want, it's kind of fun-made, and it will probably not have a big effect. But if you frame it as a more effective therapy innovation, then people will use it because they think it will be better than the previous therapy. So the expectation and the framing is crucial. Further, the second thing is that you have to be conscious about the integration of your product into this whole context. So when will people use it, and for how long will people use it, and when will people end in using it? And this integration can be very difficult, especially in healthcare and e-health, because often the information systems don't collaborate or don't work so smooth. And thirdly, it is very important to respect your patients, so and as much in your design also as possible, so to insert some open spaces in which you can let patients customize their own game elements, for instance, or their own motivations, and often this will help. So we have now the theory of persuasive game design explained. That's using game elements in order to shift people from a real world experience towards a game world experience, which is more motivating. Then we discussed method, how you can achieve it, and one case study on addiction care. And as an end note, I would say that healthcare designers are very kind of creative connectors into this great context of healthcare. We get our principles, for instance, that we use from psychology. We get our means from design practice, the game elements, for instance, and our context understanding from the healthcare system. And when we talk to the specialist, we talk to the patients, or we enter the buildings where the healthcare is practiced. And with this inspiration of all these kinds, so of the fundamental therapies or the fundamental psychological systems, the means of design and the contextual information, we can create some value, I think, for healthcare and some improvements with our creativity. Thank you.